what a lot of people don't know is that panic attacks are your friend. Panic attacks are literally the body's mechanism, because when we get caught up in, see, the only cause of anxiety is thought. It's important that people know that the only cause of anxiety, unless you've got a thyroid problem, is thought. Mm-hmm. It's the innocent underlined 30 times the innocent misuse of the gift and lack of understanding of the gift of thought. So that what happens with panic attacks is that I've asked people say, wait a minute, my panic attacks have nothing to do with my thinking. The last time I had a panic attack, I was watching the football game, or I was playing with my grandchildren. And some of you have heard me say the question that I ask is, in the 2 hours prior to your panic attack, was there a minimum of 20 to 30 minutes where you were actively worrying, stewing, fretting, or thinking some upsetting thoughts about something? And the score so far is about 5,998 to 2. And I'm not going to make those two people do a lie detector test. Mm. But I suspect they were too. So that what happens is we start creating this biochemical imbalance, and the brain says, my God, I've got to wake this person up to what they're doing. So there's a place called the locus coeruleus. And it controls noradrenaline, and it shoots noradrenaline into the person's body. And if myself and 3 other people here injected the same amount of noradrenaline into their little IV, we would suddenly get short of breath, hot flashes, cold flashes, nausea, numbness, tingling. We would have all the symptoms of what people call a panic attack. They're meant to last 3 to 5 minutes because noradrenaline's half-life is 60 seconds. So unless the person gets caught up in fearful thinking about what's happening, which many do, so that it continues for hours and is terrifying, once a person understands this and they have the courage to sit them out, within 60 seconds half of the epinephrine is gone. In 2 minutes, 75% is gone. 3 minutes, 87.5% is gone. 4 minutes, 94% is gone. And 5 minutes, 99.5% is gone. So I've had patients without medication. I said, I just want you once to be willing to trust me enough to get a newspaper, get a favorite song, whatever, to put on. The next time you have a panic attack, sit as quietly as you can and try not to feed it, and you will suddenly realize that it's past and you don't have to worry about it ever again. Ever again. Because even if you have a panic, first of all, the next time you start stewing and thinking anxious thoughts about something or giving them a lot of energy, you're going to say, why would I do that? I think this road heads over the cliff, right? Why would I drive over the cliff? The second thing is you no longer fear it happening because you know that even if it would happen, if you just get quiet, it's going to be gone in 3 to 5 minutes, and it's no big deal. So as people start to understand even the physiology behind the anxiety, that the anxiety is their friend. It's trying to let them know that they're innocently, that there's something for them to learn. Even I experience emotional pain at times. And I find most helpful to me when I am experiencing emotional pain is to see it as an opportunity. I'm getting a chance to go through another door related to understanding the 3 principles. And the answer is going to come to me if I have the courage to stay as quiet as I can, to look for a positive feeling, and to be open to insight.